Welcome. My name is Peter Strong. I'm a professional psychotherapist based in Boulder, Colorado, and I offer online therapy via Skype for the treatment of anxiety and depression and addictions and many other common psychological problems that respond well to mindfulness-based therapy. Mindfulness therapy is my preferred choice because I find it to be vastly superior to conventional talk therapy and certainly a great improvement over medications which really do nothing to change the underlying cause of your emotional suffering. So anxiety disorders are the most common condition that I work with, and this includes obsessive-compulsive disorder. And I'm often asked how to stop OCD thoughts, how to break free from those intrusive thoughts that cause so much emotional suffering and anxiety for a lot of people. So, working with intrusive thoughts, first of all, we have to ask, what is it that makes them intrusive? How does this work? Well, there's four major factors that I have identified that really cause a thought to become intrusive. The first is the emotional charge of the thought. So with all OCD thoughts, it's not the content of the thought, it's not the narrative that's really that important. What is important is the emotional charge of that thought. When a thought has a very high emotional charge, then it tends to stay in the mind longer and it tends to return more frequently than a thought with a low emotional charge. So the emotional charge is what gives the stickiness to intrusive thoughts and leads to obsessive behaviors based on those intrusive thoughts. So working with that emotional charge and learning how to neutralize it is essential and much more important than trying to change the narrative or your beliefs or trying to replace negative thoughts with positive thoughts or any other cognitive manipulation like that, because it really won't work if that emotional charge is not first neutralized. So working with the emotional charge of the thoughts is very important. The second factor that causes thoughts to be intrusive is really just plain habit. That is the lack of conscious awareness. We tend to simply identify with these thoughts when they arrive, and we get caught up in them, and we start trying to fight them or resist them in some way. So this process of pure habit operates when there's very little consciousness. Like any habit, it operates unconsciously. So developing much more consciousness around our OCD thoughts is very important. And in fact, we learn how to meditate on those thoughts rather than trying to make them go away, which is not practical, or trying to resist them in some other way or distract ourselves from those thoughts. Any kind of effort to try and remove thoughts by distraction just won't work. We have to completely change our relationship to those thoughts. We have to, in fact, create more consciousness, not less. The third factor that causes thoughts to become intrusive is really the problem of what I call reactive identification. And that is where we really become consumed by that thought. We take on the identity of the thought. We take it to be who we are. We take it as the truth of things, and we simply blindly fall into that thought. The fourth factor that's closely related to reactive identification is general reactivity to those unpleasant, emotionally charged thoughts. As I mentioned earlier, we tend to try to escape or avoid unpleasant experiences, including thoughts. We try to avoid them, or we react with self-hatred, aversion, or extreme dislike for those thoughts, which is understandable because they cause so much pain for us. But unfortunately, reactivity simply feeds the problem. So avoidance and aversion are big problems with OCD thoughts, and we have to overcome both. And again, we do this by actually developing more mindful, conscious awareness around those thoughts. We learn to meditate on the thoughts. Many people find this very strange indeed. But this is from experience. This is what I find to be effective. When people start changing their relationship to their thoughts from one of avoidance and aversion to one of meditating on those thoughts, bringing consciousness to those thoughts, and actually bringing a quality of compassion and friendliness or openness to those thoughts, then change starts to happen quite quickly. So that's part of the mindfulness therapy that I teach for OCD. But another part that's really quite interesting and not familiar to most people, but again, something I have discovered over the years of working with anxiety disorders like OCD, is working with the imagery of those intrusive thoughts. So, because they have a strong emotional charge, that emotional charge is produced by internal psychological imagery that gets activated by that thought. And in fact, the best way to heal and neutralize that emotional charge, besides not identifying with it or reacting against it, is to change the imagery of the emotion that's associated with the thought. So most intrusive thoughts are associated with some form of fear or some form of extreme trauma, for example. That's very common. So intrusive thoughts are very common in people suffering from PTSD or other form of trauma. Working with the imagery is a very good way indeed to neutralize these traumatic thoughts. Classically, some of the things I will teach you is how to identify that imagery and then how to change it. And very typically, the first thing we might do is find a way to change the position of the imagery. Where you see it in the mind is a huge part of what causes the intensity of that intrusive thought. So typically the thought is too big and too close and usually too high in our visual psychological field. So changing its position is quite important, and in general trying to turn the thought and its emotion into an object is also very, very important, which it becomes very easy when you can start to create imagery or find the imagery that describes that emotion. When you can turn it into an object, then you can begin to develop a relationship that's conscious and friendly but non-reactive towards the object. That's much easier to do than when we become identified with the thought. So there are lots and lots of different ways of working with the imagery of OCD thoughts, but those are two. We might try to change its position and then see it as an object and then interact with that object in various ways to help it change its emotional charge. Make it smaller, for example. Very classic type of intervention we can explore together. If you make a thought smaller, it will have a smaller emotional charge. It won't be so intense. It won't be so overpowering. So if you'd like to learn more about how to work with intrusive thoughts and OCD thoughts in general, please contact me, send me an email, tell me more about yourself and how I can help you. And then we can schedule a Skype therapy session to help you overcome your OCD thoughts using the very effective and well-tested methods of mindfulness therapy that I teach and have developed over the last 10 or 12 years now. So please contact me if you would like help overcoming your OCD. Thank you.